Now let's get into introduction of epistaxis. So now you have to understand that epistaxis occurs in 60% of the general population. So 6 out of every 10 people may experience epistaxis at one point in their lives. There's a bimodal age distribution. So if you are tested on age range at which epistaxis occurs, usually in young people before the age of 10, and usually in adults 45 and 65 years of age. So there's a bimodal age distribution. Know how epistaxis is classified, because this is also very important. Now, when we're solving the questions, I talked about anterior and posterior epistaxis. Who can tell me what they learned about anterior and posterior epistaxis, please, doctors?
Can I go ahead?
Please go. Yeah, please go ahead.
Yeah, anterior epistaxis is caused by bleeding from the Little's area, the Kessenbach's plexus, while posterior epistaxis is caused by the posterior ethmoidal artery.
Sure. So that's the bleeding sites, right? And the Kesselbach's area is what we also call the Little's area, right? Good. So let's do a quick review of anterior and posterior epistaxis so that in your board exam, you can be able to pick if you are tested on that. Which is more common, anterior or posterior? Class, who can help me? Which is more common?
Anterior is more common.
Anterior is more common.
Beautiful. Now, majority of anterior epistaxis is self-limiting, and majority of anterior epistaxis can be managed by primary care physician. Now, what about posterior epistaxis? Posterior epistaxis can lead to significant bleeding. So that's another thing. So if you get, a case where you are being told that the patient has significant profuse bleeding in epistaxis, think it could be posterior. Posterior epistaxis may need quick temporal packing. And most patients who have posterior epistaxis, if they present to your clinic, you must make sure they are sent to the emergency room. And in most cases, so if I ask you a question, with anterior and posterior epistaxis, which of them do you usually have to get an ENT specialist involved? The one you need to most of the time get ENT specialist involved is
posterior.
Posterior epistaxis can be so bad that at times you need to admit the patient. So doctors, if you are sleeping and Dr. Bruni appears in your dream, wake up, tell me about posterior epistaxis. Dr. Maria should be able to do that with ease, right? So this is it. How am I going to separate anterior and posterior epistaxis based on the patient presentation? Anterior is more common. Majority of anterior is self-limiting. Majority can be managed by primary care physician. Okay, what about posterior? It can lead to significant bleeding, may need quick temporal packing, most need quick referral to the emergency department, and consultation with an otorhinolaryngologist is usually necessary in posterior. And sometimes it can be so bad that these patients need to be admitted to the hospital. Doctors, before I proceed, has this made sense? Can we move on? Can we move on? Awesome.
Yes, we can.
So remember that we're talking about the Little's area and the Kesselbach's region and all those things. So this is where usually a lot of the common epistaxis occurs, okay? This is what we call the Little's area. So you realize that it is the end of many of these arteries, anterior ethmoidal artery, posterior ethmoidal artery, just a little bit of it. But the posterior bleeding usually occurs from here, all right? In the superior labial artery. But you don't need to worry so much about anatomy so far as the Q1 is concerned. I just wanted you to know that you need to master anterior and posterior epistaxis.